Good evening, everyone. I am Dr. Sarita Naik, founder of W4W Women for Women Healthcare Initiative. And today we are here to discuss a very important topic so relevant in today's times. But before I invite our guest, before I introduce her to you, I want to say few lines which are so relevant. कौन आया है शहर में ऐसा कि कोई शोर ही नहीं, न मंदिरों में नवरात्रि का कीर्तन, न मस्जिदों में रमजान की भीड़। हर चेहरा खौफ में उड़ा उड़ा सा क्यों है, हर चेहरा डरा डरा सा क्यों है। कभी सुबह से शाम तक चलती थी जश्न महफिल, बेलगाम वक्त का कांटा अब थमा थमा सा क्यों है। हर इंसान इस टाइम कुछ ना कुछ, किसी ना किसी डर से जूझ रहा है। सड़कों पे सन्नाटा है। क्यों ये अनचाहा एक बिन बुलाया मेहमान कोविड आ गया है हमारे घरों में, और इतना पास आ गया है इस बार कि ये डर मन से जाता नहीं है। कैसे निकालें इसे और कैसे भगाएं इसे। कंटिन्यूअसली हमारे साइंटिस्ट, हमारे डॉक्टर्स, हमारी टास्क फोर्स, फ्रंटलाइन वर्कर्स डेली बेसिस पे लड़ रहे हैं इससे, और क्या हमारे एक्चुअल प्रैक्टिकल हाथ में है। इन सब बातों से आज कुछ मैसेज लेंगे, कुछ डिस्कशन करेंगे, और इन सारे क्वेश्चंस का आंसर जो हमें सबको चाहिए, क्योंकि हमारे पास एक ही टूल बचा है, वो है वैक्सीन, जिसका सब इंतजार भी कर रहे थे। पर जैसे जैसे वैक्सीन आई है वैसे वैसे कंफ्यूजन्स और बढ़े हैं। तो बहुत ज़रूरी है कि एक एक्सपर्ट हमें इस बारे में गाइड करे, और इसी के लिए W4W एंड मैं डॉक्टर सरिता नायक आज आपके लिए एक स्पेशल इनवाइटेड गेस्ट, एक स्पीकर को जो एक्सपर्ट हैं इस फील्ड में, आज लेके आई हूँ। और लेट मी इनवाइट आवर गेस्ट ऑफ द डे, डॉक्टर रोहिणी केलकर। हेलो मैम।
Hello. Thank you, Sarita.
वेलकम।
That was a lovely way to begin the program. I really enjoyed that.
Thank you so much, ma'am. Welcome to this platform, ma'am. And I'm so looking forward to this session today, because not only me, you won't believe that how many queries, how many questions I have received in last 24 hours to answer, to find some conclusive answers, which even I don't have. So I'm so happy. But let me introduce you to our audience. So people, my friends, Dr. Rohini Kelkar is a very, very senior specialist in infectious disease control, who is a former professor, head of department of Tata Memorial Hospital, served that hospital for more than 30 years. And that's a huge experience, enormous experience. I think it counts a lifetime to reach there where you are, ma'am. And currently she is with Metropolis Healthcare, if I'm right. And I'm looking for so many answers today, ma'am. So pehle to, as I ask more about the questions for COVID vaccine, what I want to ask you about is how worrisome is it as per today? Means, continuously news में, हर channel पे, and सबसे बड़ी बात ये WhatsApp universities में इतना कुछ आ जाता है, information का overload. Means I stopped watching the news when I first day, when few days back when I heard कि 3 लाख से ऊपर cases हो गए हैं, which the Maharashtra has broken all the records of positive cases in one day, in 24 hours. So it was very difficult to even digest that information, and a sort of very, I was also in denial कि क्या इतना बुरा actually हो गया है. So I really want your insight, because you are sitting right in the core of that department who is dealing with it.
Okay. So you started very beautifully in Hindi. My Hindi is not that great, so I'm going to say सर्व भगिनींना नमस्कार. आज आपण जी चर्चा करणार आहोत ह्याच्यात आपण सगळे घाबरून गेलेले आहोत की हे कोविड विषयी किंवा कोविडच्या पलीकडे हल्ली काही बोलणं होत नाहीये. आणि सिच्युएशन जी आहे, येस, इट इज अ व्हेरी वरिसम सिच्युएशन. द रिझन्स आर मल्टीफॅक्टोरियल. You can't say that it's just this, is it vaccine, is it this? No, there are many things that are happening. Just as we talk about, for example, cancers, there are many different things, and something precipitates the event. So with what has happened in this pandemic is, yes, we have all let our guards down. Everybody is tired. You can imagine, डॉक्टर लोक जे 24 तास काम करतायत, आता वर्ष होऊन गेलं, त्यांना काही रिस्पाईट नाहीये. आज आपल्याकडे परिस्थिती वरिसम का झालीये? कारण आपण विसरून गेलेलो आहोत की हे कोविड काय आहे. सगळ्यांना वाटतं की आता सगळं व्यवस्थित झालेलं आहे, आता कोविड गेलं, आता वॅक्सिन आलं. So there are many things. The first is that we have started traveling. we have started forgetting to use our masks. We have started, we are forgetting what hygiene is all about, social distancing. We are gathering. We want people to get married. We want parties. I can tell you an instance where the moment 6 months ago, there was a big party of a group of people, of 154 people, and 65 got infected one night. They partied till 3 in the morning. So
Right.
yes, the strain has changed. There are mutations, but it is a combination of factors that has led us to this situation today.
Right. I understand, ma'am. And in fact, I could feel that frustration in those people who are actually taking so much precautions, who are sincerely doing their part. And when they see rallies happening, when they see gatherings happening, and when you suddenly see this surge, because I know how much high level of precautions I was taking when I was seeing my gynec patients, and suddenly you realize things were okay, now they are totally out of control. So I definitely see laxity of people towards COVID appropriate behavior, just like you highlighted masks and sanitization, distancing and traveling. Suddenly, itna suppressed tha that emotion कि हम बंद हैं घरों में. It suddenly
Mhm.
boomed out, and suddenly all resorts were booked. Suddenly, all
Yeah.
places, traveling, hotels were booked because people wanted to move. कि सोच के कि हाँ अब ये गया, but then I think it did not go anywhere. So is it really an Indian mutant? Because when I speak to my friends abroad, many of them have risen that concern कि क्या हो रहा है तुम्हारे इंडिया में, क्या हो रहा है, Maharashtra is at worse, are you okay? They are also alarmed कि is this really a mutant? Has the labs actually picked up? Can you give me an insight कि actually में कोई mutational virus है या it is just a creativity of WhatsApp?
Well, it's certainly not a WhatsApp creativity. So I'm just going to elaborate a little in technical terminology. When we speak of this virus, as I speak, the virus is undergoing mutations. So mutations are normal for this group of viruses. In fact, the influenza virus, that is the flu virus, is known to mutate far more rapidly than the SARS-CoV-2. Now, I'm going to
Okay.
just tell you that the virus, there are mutants, there are mutations, and we call them as mutations which are of interest. They are ones of concern. So these are they called as VOCs, actually, the
Okay.
VOCs. Now, the one that we are talking about today, yes, we have found that there is a mutant. They're calling it double mutant. It's actually this virus has a protein called the spike protein, and the spike protein actually attaches. It is like a bond between, as I'm showing it. So this is the spike, this is the virus, and it attaches to the cells in the lungs. So if this protein, which is the attaching protein, undergoes a mutation, it is a mutation in the spike protein. So that is the first point of contact, and that is where this change has taken place. So there are about 15 mutations that they have found. Now we as lay people need to understand, or rather the audience needs to understand that every म्युटेशन म्हणजे काय. म्युटेशन म्हणजे त्याचे जे प्रोटीन्स किंवा आपण जे अमायनो ऍसिड्स म्हणतो ते बदलतात, आणि ते बदलतात आणि त्याच्यातले काही दिसून येतात आणि काही बदलतात पण दिसत नाहीत. जसं आपण कोणीतरी एका बाईला बुरख्यात टाकलं की तिचं सौंदर्य झाकलं जातं, तसंच ह्या व्हायरसचे पण काही काही ज्या गोष्टी असतात त्या दिसतात आणि काही दिसत नाहीत. आणि म्युटेशन जरी झालं तरी त्या म्युटेशनचा काही परिणाम होईल डिझीजवरती ह्याची आपल्याला खात्री नाही. तर आपल्याला भारतात जे दिसलेलं आहे त्याच्यात त्यांना जवळजवळ 2 दाखवत आहेत ते डबल म्युटंट्स. ऍक्च्युली 2 म्युटेशन्स नाही, 15 तरी म्युटेशन्स दिसलेले आहेत, पण त्यातले 2 म्युटेशन्स जे आहेत ते स्पाइक प्रोटीन मध्ये आहेत. So that is what has actually happened, and this is how these mutants are actually creating havoc. But this virus is not understood. The Indian mutation is under investigation. So let's leave it under that. Now, when a
Right.
virus mutates, what happens is it actually it causes more severe disease. It is more transmissible. That is important for us. म्हणजे की एका माणसापासून दुसऱ्या माणसाला हवेतून याचा ट्रान्समिशन होतंय. तर तुम्ही जर का एका बंद खोलीत बसलात, एअर कंडिशनिंग चालू आहे, आणि एक पेशंट जर का असला तर तुमचे जे काही लोक आहेत तिथे बसलेले त्यांना सगळ्यांना इन्फेक्शन होण्याचे चान्सेस आहेत, आणि असंच फॅमिलीज मध्ये ट्रान्समिशन होत गेलेलं आहे.
Ma'am, before I go to the vaccine, because I've already started having questions on the comments, and I'll show you those all
Yes.
questions also. एक मुझे please बताइए कि because we understand as clinicians and as scientists and all lab research is telling कि mutations are real, they are bound to happen in viruses, और हो सकता है कि ये mutations हैं और they are real. So कितना significance रह जाता है RT-PCR टेस्ट का? एंटीजन टेस्ट का जो अवेलेबल किट्स हैं, बिकॉज मेरे पास इतने सारे पेशेंट्स मेरे आसपास, मेरे
Yeah.
नोन टू लोगों में ही हैं जो दे आर नो सिम्टम्स and their test is positive. Just
Okay.
giving
Yeah.
examples, जैसे high rise towers में maids, helpers, drivers सबका test compulsory हुआ. There were almost 30% people who had zero symptoms but they had positive test. So is it that the test is not right? या एंटीजन में पॉजिटिव आया तो आरटीपीसीआर नेगेटिव है, या फिर किसी ने डायरेक्ट एंटीबॉडी करा लिया और कभी कुछ हुआ ही नहीं था, एंटीबॉडी पॉजिटिव है. सो इज इट दैट द टेस्ट आर फॉल्स नेगेटिव और पॉजिटिव बिकॉज ऑफ दीज म्यूटेंट्स व्हिच आर नॉट पिक्ड अप बाय दिस आरटीपीसीआर? दिख रहा है सिम्टम्स हैं और पेशेंट का टेस्ट नेगेटिव है.
Okay. So let me clarify that a positive RT-PCR is very rarely going to be a false positive because it has what we call technically a high positive predictive value. The problem is with the negatives. You can get false negatives. Now this is another lecture by itself. False negative means there can be issues with sample collection, time of collection, the way it is collected. So there are multiple factors. So I would worry if I get a false negative. And let me also assure you that we have been conducting thousands of tests. Since you mentioned that I'm attached to Metropolis Labs, we are conducting thousands of PCR tests on a daily basis. And the mutant that is currently going around, we are able to pick it up. The justification for this is that when you look at RT-PCR, the mutation is in the spike protein. In an RT-PCR, we are looking at multiple genes. So we don't just look at one, we look at two, we look at three. So we look at a combination and everything doesn't change. So we are picking up this current strain with the RT-PCR. And what you're saying is true that yes, asymptomatic people can also test positive and there's nothing wrong with the test result. The point is that it is the asymptomatic people who are transmitting the infection without knowing. So even if you are in contact with a positive patient, you should get yourself tested. I know that there is a problem with availability of tests also, but let me assure you that yes, the RT-PCR, a positive result does mean that you are infected with the virus.
राइट. सो मैम, कैन आई से कि ये दो सिचुएशन जहाँ पे पेशेंट को कुछ नहीं है और डेफिनेटली टेस्ट पॉजिटिव है इज अ कॉशन मींस ये उसकी रिस्पॉन्सिबिलिटी है कि वो ये वायरस दूसरों को ना दे. सो टेक प्रिकॉशंस, आइसोलेट एंड फॉलो, अपने लिए नहीं तो दूसरों के लिए. और वो पेशेंट्स जिनको सिम्टम्स है बट टेस्ट नेगेटिव है, वो क्या मींस इट मींस दैट दे नीड टू रिपीट द टेस्ट एट डाउन सम पॉइंट दे विल बी पॉजिटिव, या फिर दे व्हाट इज फॉर देम?
So the time of testing is very important. From the point of infection or contact, the PCR is most sensitive 5 to 7 days after contact or after infection. So it may happen that you're just symptomatic today and you have a negative result. So what we recommend is that you repeat the PCR after 48 hours. And there are other tests that we are also performing. For example, there is the HRCT, which is being performed. So if there is a doubt, then the doctor would advise you to do other tests. But please don't go on a rampage just testing, because people want to do a PCR test, then they want to do a CT scan. So don't do these yourselves, because we do have a scarcity of resources. Let your doctor decide. Talk to the doctor, talk to them on the phone, and I'm sure they will advise you correctly. But definitely isolate yourself if you're symptomatic.
डेफिनेटली. सो आई थिंक ऑडियंस, वेरी क्लियर मैसेज हेयर. अगर आपको सिम्टम्स नहीं है और आप टेस्ट पॉजिटिव हो तो दूसरों के खातिर आइसोलेट हो जाइए, और अगर आपको सिम्टम्स हैं तो वेदर टेस्ट इज पॉजिटिव और नेगेटिव, अपने लिए अपने खातिर आइसोलेट हो जाइए, because the symptoms may not exactly replicate with test depending on किस time पे test लिया गया है. Thank you so much, ma'am, for covering this part, because I already want to start asking you questions for vaccines. Before that, I actually want to highlight this fact for our audience कि हम लोग as clinicians, we are wearing PPE kits, we are trying to solve issues, we are still doing online consults, but please think of the lab people. This is my appeal to all the people who are out there who want to go to lab, want to push them to give results. Understand that a microbiologist or a lab person is sitting right in the middle of the virus sample. A microbiologist, even a person who is collecting a sample, is sitting with the samples who may have active virus. So a small, reflection on what a doctor goes through, what a person who is dealing with COVID patient goes through in these tough times, I would really like our audience to see. So I just want to show this clip. people who are watching us, please have regard to, clinicians, people, lab workers, paramedical workers who are coming your home to take samples. Understand they are sitting right in the middle of active viruses, and it's the worst phase which medical fraternity all over the world is facing. So coming back to our main topic of the day, ma'am, vaccine. Now, vaccine was one thing जिस पे last year सब लोग इतना hope लगा के बैठे थे. It was so hopeful, and there was suddenly the vaccine available for the front workers first, and then slowly to senior citizens, and now it's getting open to 18 years plus very soon. Now, itna information overload, itna availability of resources, itna availability of knowledge, I think has confused people more than actually trying to help. मीन्स वो बोलते हैं ना, जितनी चॉइसेस ज्यादा उतना आपका कंफ्यूजन ज्यादा. अगर एक ही वैक्सीन होती तो सब आंख बंद करके लगा लेते, मतलब कोई चॉइस ही नहीं था. इट इज सिंपल, टेटनस का एक इंजेक्शन एंड एवरीबॉडी टेक्स इट. सो इट्स लाइक इंफॉर्मेशन ज्यादा होने से कंफ्यूजन्स बढ़े हैं. तो मैं आई स्टार्ट फ्रॉम वेरी बेसिक. आई वुड लाइक टू नो फ्रॉम यू कि एट द मोमेंट व्हाट ऑल इज एक्चुअली अवेलेबल, कौन से ब्रांड्स, कौन सी कंपनीज, एंड क्या डिफरेंस है सारे अवेलेबल कंपनीज में.
Okay, this question is very simple to answer at this point. In India, we have only 2 vaccines that are currently available. The first that was introduced is called Covishield, which is from a company called AstraZeneca, and the second one is called Covaxin, which is from Bharat Biotech. It is an indigenously prepared Indian vaccine. I'm going to explain the difference between the two. The first point is that don't try and choose the vaccine. Let your doctor decide. We'll come back to some of those points. There are some situations where you would choose Covaxin over Covishield. We can look at that also separately. So what is Covishield? The idea of a vaccine is that you get exposed to some parts of the virus, that is SARS-CoV-2, and your immunity, your immune system is primed or sensitized to A, identify the virus, and B, respond in the form of antibodies. So any vaccine that you take is going to do the same thing. The technology is different. That is the difference between the 2 vaccines. The AstraZeneca vaccine, which is Covishield, is using the technology of a viral vector. So this is a virus that causes the common cold, but it is picked up from a chimpanzee. It cannot multiply. So what is done is the proteins of the spike protein that I talked about earlier of the virus, which attaches to your cells, those proteins are picked up, put into another virus, which cannot multiply in your body. It's not pathogenic. It cannot cause disease. So that is put into your body, and your body cells process it, identify it, and react to it. So this is, मी मराठीत सांगू शकत नाही कारण हे थोडंसं टेक्निकल आहे, पण कुठलाही फॉरेनर आपल्याकडे आलं की आपल्याला कळतं की हा फॉरेनर आहे, आपल्या बॉडीला समजतं आणि आपला बॉडी त्याला रिॲक्ट करतं आणि अँटीबॉडीज म्हणजे इम्युनिटी डेव्हलप होते. हे अगदी साधं वे आहे. आणि द सेकंड वॅक्सीन इज कोवॅक्सिन. So Covaxin is a killed virus. So the virus was actually grown in cell cultures by the Indian Council for Medical Research at the National Institute of Virology, and it was killed with heat, chemicals, or radiation, and they're using the whole virus, which is killed, to produce the same response. The difference between the two is technical. Covaxin also produces antibodies against the spike protein, and so does Covishield. Covishield only against the spike, Covaxin against the spike and the rest of the virus as well. So these are the 2 viruses available. Now we need to be prepared because the Americans are using a different technology, which is called as the mRNA technology. It's the same thing, the DNA or the RNA. The RNA is put into a lipid particle in the mRNA vaccines. So a lipid is like the carrier molecule because the proteins disintegrate, the proteins cannot survive, they'll be thrown out of the body. So the lipid controls the proteins, and it is actually a passage, it is a carrier for the RNA to go into the body and produce antibodies. The response is the same. So in the United States, there are 2 vaccines. One is produced by Pfizer, and the second is called the Moderna vaccine. These are the 2. And there is one more vaccine which is introduced called as the Johnson & Johnson, or the Janssen as they pronounce it, vaccine, which is similar to AstraZeneca but is given in a single dose. So these are the 5 vaccines that are available. There are 2 Chinese vaccines, which are also killed vaccines. And there is one more vaccine, which is probably going to come into the Indian market called a Sputnik, which is again the viral vector or the adenovirus vector vaccine. So in a nutshell, these are the vaccines currently available. There are again at least 150 odd molecules under research, but as of now, this is what we have.
राइट मैम। मैम एक बड़ा ना क्वेश्चन आता है, बहुत लोग मुझे पूछते हैं सामने से, शेल वी वेट फॉर फाइजर टू कम टू इंडिया, शेल वी वेट फॉर दिस, शेल वी वेट फॉर दैट। आज कोविशील्ड हमें यहाँ मिल रहा है, बट कोवैक्सीन के लिए जे जाना है, वहां जाके आए। एंड समटाइम्स आई हैव नो क्लू एंड नो आंसर टू जस्टिफाई दिस कि इनमें से क्या एफिकेसी है क्या नहीं है, बिकॉज दे हैव देयर ओन रीजंस। इतना सब पढ़ रहे हैं, इतना सुन रहे हैं, और इतना इजीली यूज कर लेते हैं ना हम लोग ये टर्म्स कि ये एफिकेसी इसकी 60% है, इसकी एफिकेसी 90% है, सो आई विल गेट द वन जो बेस्ट है, rather than thinking कि you are losing time on it. So what is your word कि efficacy को लेके इतने confusion, इतने doubts क्यों हैं? And does it really mean anything? Because lately I have been seeing patients who have done vaccination and still they are COVID positive. So इनका कोई significance भी है क्या इस word का?
Okay. So first, let's try and understand what is efficacy. There are 2 terms. To tell you honestly, until this COVID thing came up, even none of us were aware of what this is all about. So efficacy of a vaccine is judged during a clinical trial. And what is actually done is, so the vaccine is given after it's gone through during the phase 3, phase 2 and 3 phases. The vaccine is given to a group of volunteers, and then you have the non-vaccinated population. So the efficacy is judged in a controlled manner, vaccinated versus non-vaccinated, but not the community. So that is the efficacy. And I'm going to read out, because people keep asking this question, what is the efficacy of all these vaccines? I'm actually going to read it out to you. So Covishield, which is being used, Covishield efficacy 82.4% when you give the second dose at a 12-week interval. People who want to actually can write it down, because this is very easily understood. Covaxin, 81% efficacy. If you see, there's hardly any difference, 81%, 82%. Nothing can be 100%, that's for sure. If you look at the Pfizer vaccine in the United States, 95% efficacy. If you look at Moderna, 94%. So in a nutshell, we have 2 vaccines, efficacy 81, 82%, US 94, 95%. What is important to understand is when this vaccine is rolled out in the community, that is what we call as effectiveness. Effectiveness is uncontrolled, because there are people who have comorbidities, they may have cancer, they may have some other issues. Now, effectiveness is something which is completely different. So let's just leave it at that. That there is not much of difference between the efficacy of the vaccines in the Indian market today. So go ahead and take whatever you get. Don't be too choosy.
Right. Fine. So I will take this message and I'll speak it loud and clear to all the people who are hearing us, listening at this in this moment. Please do not get affected by these numbers. The best vaccine is which you can find it earliest and get yourself vaccinated. Don't fight for these numbers जिनका कोई value नहीं है unless they are rolled on a mass scale, which actually the time will tell. So इंडिया में अभी कोविशील्ड और कोवैक्सीन ही है जो आपके घर के पास सबसे पहले मिलती है, प्लीज वही आपके लिए सबसे ज्यादा इफेक्टिव है. That's what the message I am taking. Those people who like numbers, ma'am has just told 84% for Covaxin, 81% for Covishield, which is equally good. In fact, much better than why you want to end up with a disease and ending up. So it's better to have some immunity, whatever you are getting it right now. Ma'am, there are already so many questions for who to get the vaccine, who not to get the vaccine. I like to highlight some questions because I'm sure patient wants their answer. There are definitely a complete list of not to be given. First question here, somebody, Meenakshi Doshi has asked, second trimester vaccination. First of all, actually, is the vaccine okay for a pregnant lady? Whichever, anyone.
The vaccine is not, that's one of the conditions. Vaccine is not recommended during pregnancy because we don't have enough data on pregnancy and vaccination. So please don't go ahead right now. Just take precautions.
Right. So, Meenakshi, you have got your answer. Vaccine is not for pregnant women. For you, the only best way is to isolate, to take the precautions. Ma'am, it gives me another question. A person, a lady who has got the vaccine and accidentally realizes that she is pregnant. Now, what to do? Is there any guidelines on the vaccine itself? Because there's so much of scare and fear that unknowingly she was pregnant, and in that window period, she just got vaccinated. Is there anything which you would like?
At this point, I don't think we have an answer to that question. I would say it's not like I'm going to use a slightly different situation here. We know that somebody who gets hepatitis C virus during pregnancy, I'm sure, Sarita, you would say terminate the pregnancy. But with
Yeah,
COVID, we don't have any such information. So I would
right.
just go to the doctor, continue the pregnancy, and hope for the best. At this point, maybe you can add something, but I don't think we have an easy answer for this one. But
Right.
if you're
So,
planning a pregnancy,
yes.
I would suggest that don't take the vaccine. Now, there are people,
Okay.
there are youngsters, and there are healthcare workers and doctors who are actually not taking the vaccine because they're not sure they want to plan a pregnancy. So that's a dangerous situation to be in, because how long are you going to go on like this with the pandemic just going haywire and spreading like fire?
Sure, and that actually answers my next question, ma'am, because I just was about to ask you that, being a gynec, these are my concerns, because my patients who were on hold for fertility treatment, planning for pregnancy, and they were holding on the IVF cycles as well. And kitna rokenge, it's almost more than a year.
Right,
They are already on a biological clock ticking, and already everything was ready. So yes,
right.
so I think I've got the answer. So women, if you're hearing and if you're planning for a pregnancy, vaccine is not for you unless you delay the plan of pregnancy for a while. There are no absolute answers if you end up conceiving immediately after vaccine. Right. So more data to come, and we will find surely these answers in future. Ma'am, another question somebody has posted here. Mangla Megraj want to know that her husband has prostate cancer and was on chemo. Is he eligible for vaccine? So it takes me to a question that what about if somebody is on cancer chemotherapy, or let's say just diagnosed with cancer
So
and
there are
going to
no
survive?
contraindications for the vaccine in patients with cancer, on chemotherapy, immunocompromised, diabetes. All these are not contraindications for the vaccine. It may happen that people who are immunocompromised do not mount a sufficient antibody response. But there are many questions for which we don't have answers. We don't even know what is the protective titer as yet. So, but there are no contraindications. And again, I'm going to use another situation where with the hepatitis B vaccine, which is now universal, hepatitis B जो liver का cancer हो सकता है, जो infection से, that is also a virus. So with the hepatitis B vaccine, the cancer patients, we have a study where they didn't mount a sufficient antibody response. So we used a double dose. So there are
Okay.
ways in immunocompromised patients where you can actually use the vaccine successfully.
Right, right. Ma'am, another very interesting question is, can both the vaccines react? Means here somebody is asking that एक shot Covishield ka liya hai, that can the person go for co-vaccine? Is it possible? Is it right?
You cannot mix vaccines. This is
Hmm.
something I say very often. Yes, you mix drinks with a cocktail, but in science, whether it's antiseptics or vaccines, you cannot mix vaccines. It's not acceptable. If you've taken Covaxin, you have to complete Covaxin, because we're looking at about 1 year's immunity. If you've
Okay.
not responded to one of the vaccines, that's a different story. We can look at it separately, but we don't have
Yes.
any data, and definitely you can't take two vaccines together.
Yes, ma'am. This person ME7th has really given a detailed question. What she is looking
Yes.
for is that the person has taken anti-rabies intradermal injection, and is it safe for the person to take the first dose of COVID? So the question is, other vaccines with COVID vaccine, is there a limitation?
It's an interesting question. Again, it's very unusual that this is pertaining to anti-rabies. But if you have to take any vaccine along with you have to keep along with the Covaxin or Covishield for COVID, you have to maintain a gap of at least 14 days. So if you've taken it today, then I would wait for 2 weeks, 2 to 3 weeks, and then take the this vaccine.
Sure. I hope on May 7th you have got your answer, that keep a safe gap of at least 2 weeks between two shots, the COVID or whatever vaccine you have chosen versus your anti-rabies. So that
Yeah.
answers. Ma'am, very important question, since the government has opened for 18 years plus, and since morning I have got at least 5, 6 circulating, messages that during periods, can vaccine be given or no? Or a person on, Dr. Nitin Kochar is asking here, a person on oral pills or during menstrual cycle. Lately, for last 24 hours, I have got this creative which says 5 days before periods, after periods, one should not take vaccine because the immunity goes down. And I was quite surprised because I have not received any gynec guidelines so far. Please highlight
That's
on that.
that's an interesting question. As of now, there are no contraindications with menstruation and the vaccine or with oral contraceptives. In fact, in the United States, they're using the vaccines in all, even in youngsters. Nobody has discussed this. The CDC, which is the gold standard for all these guidelines, the CDC has not even discussed menstruation. So I don't think there is any connection with this. Just before I came on the talk, I had an interesting question from a colleague of mine whose sister took the vaccine during her menstrual cycle, and the bleeding, and she had heavy bleeding. So the question asked was, is it related to the vaccine? And I promptly said, because I was coming on the show, I said, no, it's not related to the vaccine. Now, that was an emphatic statement, but I don't think there is a huge stress factor. And everybody, I mean, Sarita, you know very well how stress controls menstruation. So I think it's not related to the vaccine. It's more the stress of the vaccine than the vaccine itself.
I'm so happy, ma'am, establishing the fact, you validating it, that the period cycle, menstrual cycle has nothing to do with your vaccination schedule. Please go ahead, get it as early as possible. That's perfectly okay. And vaccine is not going to give you heavy periods and other menstrual issues. That's just your perception and maybe coincidental. Ma'am, let me cover all these patients who can do, who cannot take it, and who can take it in this segment
Sure.
only.
Yeah.
So I have question with, is heart medicines a hindrance? Somebody who is on heart medications, and I will also like you to comment on blood thinners, because majority of heart patients are on blood thinners.
Okay. So as of now, the medication is not a contraindication for the vaccine. Age is not a contraindication. And I'm going to use the example of my own mother. She's 88 years old. She's had a stroke, and I gave her the vaccine, and she was fine. She had no reaction, nothing. And she's fine as of today. She's ready for her second dose. So I think, since you haven't asked me this question, but I'm just going to move on to this huge question of clots, and clots. Everybody's talking about the blood clots. Okay. And so they have found, these are now statistics. It's not meant to frighten anybody, but we know that the risk of getting blood clots following COVID is probably 10 times more than with vaccination. With all the vaccines, now it's not just Covishield, they have also found some cases of clots with the Pfizer vaccine in the United States, with the Janssen vaccine. So this is something which is related to production of antibodies. Recently in Germany, they have found in a study that patients who have blood clots and the incidence of blood clots, आता मी मराठीत परत सांगते, incidence म्हणजे किती प्रमाण आहे या क्लॉट्सचं, in 1 in 100,000 is the incidence that you can have this rare, very, very rare reaction. So clots is the rarest of reactions that we have found to Covishield, because Covishield has been given to more than 30 million people today. I think it's almost close to 40 million who've received Covishield. So what they found is that the vaccine induces what they call, it's a term called as VITT, vaccine induced thrombotic thrombocytopenia. म्हणजे जे आपले रक्तामध्ये जे प्लेटलेट्स असतात त्यांच्या विरुद्ध अँटीबॉडीज प्रोड्यूस होत आहेत आणि त्या अँटीबॉडीजमुळे क्लॉटिंग होत आहे. This is the theory that they have put forth. It is very rare, and it is, if it does not happen after the first dose, it's not going to happen. So I don't think we should really worry about it, because the risk of getting COVID and COVID related complications is much more than the risk of getting an adverse event from the vaccine. So I think let's just leave it at that. And there are other things. बाकीच्या गोष्टी, जनरल पॉप्युलेशन मध्ये किती लोकांना क्लॉट्स होतात, बायकांना आणखीन किती क्लॉट्स होतात, ह्याचा जे डेटा आहे, that is all being compiled. They have paused some of the vaccines, the Janssen vaccine in the US, but I think over the weekend they will probably release it, because we are being cautious. We don't know what is the safety. Technology is new, disease is new, vaccine is new. We don't have an option. Go ahead and hope for the best. That's all I can say, because it is a very, very rare complication, the blood clots.
Right. Thank you so much, ma'am, because that was my next question, the clots. And a lot of, scary cases we hear randomly from people कि vaccine लगाने गए थे, उधर heart attack आ गया, अगले दिन बुखार आया, फिर उसके बाद फिट पड़ा, फिर the person expired. So stroke हो गया, मतलब वहीं पे गिर पड़े, घर आते ही चक्कर आने लगा. So there are so many, maybe they are coincidentally happening and because of other factors, but definitely at this platform, by your presence, I think we can conclude that they are not related. They are not happening because of vaccine. So safely, you please go ahead. Somebody, okay, there is a question here. Kausha Doshi, can the vaccine be taken in pregnancy by medical professionals who are at risk of exposure of seeing COVID patients? I think Kausha ma'am has already said that no
Yes, yes, yes,
pregnancy
yeah.
or planning of pregnancy should not take in these vaccines. And if you are a medical professional, then you have to be extra cautious that you are going to get exposed. And if you are pregnant, then you have to prioritize and choose, at the moment
Absolutely,
what you
yeah.
want to do. So
I
I
would
think
say
that is,
switch to, as a doctor, medical consultation, switch to online consultations. We have to
yeah,
change our pattern of working today. So
okay.
if you're pregnant, please
Sure.
stop seeing your patients and go ahead with online consultations for now.
Right. Yeah. And another interesting question, very common: patient who has herpes, can the person take the vaccine, ma'am? On herpes, I understand the
Well,
concern is immunity and immunological
yes.
part to it. Yeah.
Herpes is actually a reactivation due to some other immune related or non-immune factors. So I don't think there is a contraindication. But in fact, I had this situation in my own family when a relative had herpes zoster, and the doctor said, "Don't take the vaccine now." Technically, there is no contraindication. So if you're, what I would do is wait for at least 2 weeks and then take the vaccine. So wait for 2 to 3 weeks till the acute phase. The problem is that with herpes, you can have fever, you can have pain, and the vaccine can also cause pain. So there is a clash of these two things. We don't have any guidelines to say that it is contraindicated with herpes. But I would play safe and say wait for 2 weeks and then take the vaccine.
Sure. So, Dr. Nathan Kochar, answer is wait for 2 weeks till the herpes settles. Now, another very interesting questions which actually opens up Pandora's box. Priya Datta asks that, hi, doctor, I have eosinophilic inflammation of my lungs. That means eosinophilic response, allergic response is high. And that's what I wanted to ask you next, that people who have allergies, who have drug allergies or past history of
Yeah.
allergic reactions, hypersensitivities, how do they go about it?
Uh, well, the answer is that although they say that with allergies it is contraindicated, the definite contraindication is if you have reacted or you have an allergy to any of the components of the vaccine, or if you have had an anaphylactic or an allergic reaction to a vaccine. And here I'm going to use my own example. I have multiple allergies. When I went ahead with the vaccination, I was really scared. What precautions did I do? Did I take, for that matter? I made sure that there was a critical care unit right there. So I took my vaccine, and I'm saying where I took it at KM Hospital, because I knew that they have an ICU there. So with precautions, you can go ahead and take the vaccine. The only actual thing that is required if you have an allergy or an anaphylactic, which is the most severe form, is to give you steroids. So as long as you have steroid injections available there and you have a doctor around, I think it's quite safe. That is why we make patients wait for half an hour after the vaccine. So again, I can say yes, I was scared the day I took the vaccine. I had a very close friend sitting with me for half an hour, making sure that nothing happened. Maybe all of you don't have this, but take the vaccine at a hospital if you have history of an allergy, and rest assured, all will be well.
I think this was such a great disclosure, ma'am. Always a self disclosure that's also coming from a senior specialist doctor who is expert in this field. So, people, please listen carefully. Hear the ma'am out that she went ahead with the vaccine despite having herself allergies, because that's the only way out of this pandemic. Yes, the precautions means that you go to a tertiary center where everything is available in case you need a help, and keep a person with you. Okay, ma'am, another very interesting question. My son suffered from cold fever cough for 7 days, taken first dose of vaccine. How long to wait for second dose? So first dose of vaccine, we will actually come to all those scenarios कि first
Yeah.
vaccine के बाद अगर ऐसा कुछ होता है तो second dose कब लेना है?
ओके. मी आता मराठीत बोलणार आहे, कारण कोवॅक्सिन आणि कोविशिल्ड ह्यांचे सेकंड डोसचे ड्युरेशन वेगळे आहेत. मी आधी कोविशिल्डची चर्चा करते. पहिल्यांदा आपल्याला 4 आठवड्यांनी घ्यायला सांगत होते, पण आता जो काय अभ्यास केलेला आहे, जे काय रिसर्च झालेला आहे, अगदी क्लिअर आहे की वॅक्सिनची, आणि मी हे आधी पण सांगितलं, दॅट द एफिकसी ऑफ द वॅक्सिन इज 82.4% इफ द सेकंड डोस इज टेकन ॲट 12 weeks. In the United Kingdom, where they have maximum experience, they are actually recommending that you take the vaccine, the second dose, at 9 weeks. So whether you have a cough, cold, fever, the vaccine dose does not change. I would say the Indian government is doing a reasonably good thing, saying that you can take it between 6 to 8 weeks. If you can delay it, take it between 9 to 12 weeks. Again, we don't have enough data. So between 6 to 8 weeks is good enough. Actually, somebody asked me this question: when can I take my second dose? Because the first of May they're going to start vaccinating everybody, so we're going to have a problem. So I said, look, if you've crossed 6 weeks, just go ahead and take it on the 30th of the month. So this is something for Covishield that we know that it should be taken after 8 weeks for sure, or at 8 weeks. With Covaxin, the second dose is given after 28 days, that is 4 weeks. So every vaccine has its own second dose time. Please stick to the time. If there is a delay, nothing will go wrong. I need to explain to you what is the second dose theory. Sarita, I'm just taking the liberty so that people understand why
Sure,
we
ma'am.
have this.
Sure, please. Yes, please, ma'am.
पहिला डोस घेतला की आपल्या बॉडीला कळतं ही हे काहीतरी फॉरेनर आपल्या अंगामध्ये आलेलं आहे, काहीतरी वेगळंच आपल्याकडे आलेलं आहे. आणि आपल्या जे जंतू इम्युनिटी जी असते, द इम्युन सेल्स दे स्टार्ट रेकग्नायझिंग दिस अँटीजन एज समथिंग एज बिंग फॉरेन. दे नीड टू बी स्टिम्युलेटेड अँड यू हॅव अँटीबॉडीज अँड यू हॅव मेमरी सेल्स. मेमरी सेल्स म्हणजे जे आपल्याला ओळखतात, हे ओळखणारे सेल्स आहेत की आपल्या याच्यात काहीतरी हे कोविड म्हणजे काहीतरी फॉरेन बॉडी आलेली आहे. ही रेकग्निशन प्रोसेस ह्याला थोडासा वेळ लागतो. अँटीबॉडीज सुरू होतात. त्या अँटीबॉडीज कमी झाल्या किंवा खाली पडल्या त्याला आपण ट्रफ म्हणतो. ॲट द ट्रफ पॉइंट यू नीड टू टेक द सेकंड डोस. So this has been actually worked out in various studies. What is the trough? And that is how the second dose has been decided. So this has already been decided. If you take it at the trough, your second antibody level will be much higher than the first antibodies. That is why we take the second dose. So this is all at present, it is speculative in the sense that we have done studies and said 4 weeks for Covaxin and 12 weeks for Covishield. That is how it goes. But it doesn't mean that if you have taken the vaccine at 4 weeks, Covishield at 4 weeks, you're not going to get antibodies. You will get antibodies. They may not be as high as if you take it at 3 months. So definitely you will get antibodies. That's what it amounts to. And go ahead and take the second dose of Covishield between 6 to 8 weeks. Nothing wrong with it. We'll assess, we'll evaluate, and know whether you're protected or not.
So, Shamita, I think ma'am has precisely answered your question, that because you are concerned that what's the ideal time gap between first and second dose, and would there be any contraindication if there is a delay. So ma'am has reasonably answered it very well, that whatever the schedule of a given vaccine is, try to follow that as much as possible. And even if there is a delay, there is no harm. Please go get and complete the course. Right, ma'am? I have taken that message.
So we have a window of almost 40 days for the second dose. So please don't worry.
Right.
Just go ahead and take the second dose. Even if the vaccine is not available, there is a shortage. With Covishield, of course, you have a long window. With Covaxin also, we have nearly a 40-day window for the second dose. So please don't worry. Nice to hear from you, Shamita. Glad you girls are listening. This is some of my staff that's listening in. I'm happy that they've joined in.
Ma'am, there are more than 100 people right now who are online listening to you live, and I'm getting so many comments and questions. So I need to really structure that, because everything will go away otherwise. So before I actually jump to कितनी देर तक असर रहता है और कितना लास्ट करेगा, I really want to compile कि किसको लेना है और किसको नहीं लेना है. So ma'am, are there any absolute contraindications जिसको बिल्कुल नहीं लेना चाहिए?
So I'm repeating this. The absolute contraindication is if you are less than 18 years, that means children can't get the vaccine. So 18 years up to even 100 years is safe. So age is not a bar. Sex is not a bar. If you have a hypersensitivity to non-hypersensitivity to any vaccine or to what is contained in the vaccine. Now in Covaxin, there are different components. There is alum, there is a different IMDG, which is the additive that is being used. If you have known allergy, otherwise you can go ahead and take the vaccine. Even if you have allergies, like I said, you can still cover. You can take antihistaminics, you can take steroids, but under medical supervision, and you can go ahead and take the vaccine. So there are really no contraindications. Of course, we've talked about pregnancy. So pregnancy, less than 18 years, and hypersensitivity, these are the three absolute conditions where we would not recommend the vaccine.
Right. Ma'am, the question has just popped up, breastfeeding and lactating mothers, because they are the one who are so close to the kids.
So there is data that the Pfizer vaccine can be given to lactating mothers, but we don't have any data on Covishield and the Covaxin. So at this point I can't answer because we don't have the Pfizer vaccine. It's that data is building up. I don't see any. If you look at it scientifically, I don't see any risk. Maybe Sarita, you're in a better position to take on this question, but I don't see technically that there is any risk for vaccination with lactation. Maybe you can
Yeah.
add something to that.
Ma'am, so far there has been no clear-cut guidelines that whether how much the virus is transmitted and excreted in the breast milk and whether it can pass an active COVID infection to the baby or no. We don't know it clearly. So at the moment, breastfeeding, lactating mothers are on hold. We still don't know what can be the result to the baby. So that's why we are just keeping them on hold till we get more data. So my answer stays the same as you, that we just wait for a little bit more while. Till that, let other members of the family get vaccinated so that at least if you get COVID, at least somebody is there to handle the baby. So ma'am, this was all about who can take, who cannot take. I have one last in this list. What about immunological malignancies? Multiple myeloma, some bone marrow disorders, and sort of people who are either immunosuppressed because of they are on steroids, so that we don't know whether the vaccine will induce actually a good response, or in which the immune system is very hyperactive, means it reacts badly, rheumatoid arthritis, SLE. So we can't judge their immune response. So at times even I'm also clueless ki myeloma ke patient ko whether I should say yes or no. They already have high bands, M band, and all those things.
Yeah.
How are they going to react? So just a word on that.
So scientifically, we don't have any justification for not using the vaccine on these people. Like I use the example of hepatitis B vaccine, maybe we need to look at the antibodies in these people, because the only thing that can go wrong is they may not develop antibodies, which may not be protective, or they may develop antibodies at low levels, which we need to boost with another dose, with a booster dose. So whether you're going to need boosters, if you don't develop antibodies, that actually takes me to an important point. If you've done 2 doses, or if you've taken 2 doses of the vaccine, I would encourage everybody after 2 weeks to get your antibody titers done. Now, this is an interesting point. Sarita, I'm just quickly going on because we may soon run short of time. This is
Sure.
important. The antibodies that you test are of different types. What everybody tells me is, oh, I have antibodies. I have antibodies, but what antibodies? Is it quantitative? Is it qualitative? There are many questions. So the vaccine related antibody, and I'm very, very specific about this, the vaccine related antibody is a neutralizing antibody. Neutralizing is actually done in vitro biological systems, which is of IgG in nature, and it is to the spike protein. So I'm repeating what I just said. The post vaccination response can only be judged if you do a quantitative neutralizing spike protein antibody of IgG class. I have to be very specific about these. If you don't understand, please write down what I'm saying. This is very important. And these are offered now currently by many different labs. Of course, Metropolis is offering a test which is called COVID Protect. I'm not advertising for anybody, but I know what is being done, so I can tell you. Other labs, including in Mumbai, it is SRL, Suburban, they all are offering. It has to be a quantitative response. So please make sure that you get a quantitative result. I'm repeating, spike protein neutralizing antibody, IgG, is what we need to do. So I think this answers the question as to how do you judge whether the vaccine has been effective or not. I'm just adding one more line. Whether your titer is protective or not, today, if you tell me the cutoff is 15 units per liter and per ml, and your antibody titer is 18, I don't know if you're protected. But if you tell me your antibody titer is more than 2,500, which is the limit of the assay, I'm very happy. I'm going to say, hey, you made it. Okay, that's all. But in between, we don't know what is the protective titer. We don't have any data. We'll have to follow these people for more any development of COVID or non-development. We just have some data that the breakthrough infections after the second dose with Covishield and Covaxin are something like 0.03% and 0.04%. So breakthrough infections after vaccination are low. This is very encouraging. This is from a small number of patients who have been cases who have been immunized. But that's all I can say for now about breakthrough infections.
Right, right. I agree so much, ma'am, because these questions have been so vaguely affecting everybody. I'm already receiving so many questions regarding drug allergies, that moxifloxacin allergy, say whether they should take the vaccine or no, then sulfa allergy and whether it is safe. So we have already discussed all these parts. I understand that everybody knows if there is a history of allergy, then go to a center where adequate measures are there in case you get allergy, but it should not stop you for taking the vaccine per se. Anticoagulant question, yes, I already discussed that. Those on blood thinner, they need to discuss with their physicians how to stop
Yes.
the blood thinner for a time, go for the vaccine, and then when to restart them again. So your physician is the right person to stay in the loop. Now, ma'am, lot of important questions which I do not want to miss for shortage of time. A very important question, ye immunity kab tak rahegi? I think there have been 4 questions in a row to me. I can see them in chat
Yeah.
that people want to know ye vaccine lagane ke baad how long is this immunity going to last? So
As
any
of
word?
yeah, as of now, we know the immunity will probably last you for around 10 months. The data is so small that we can't say, but 10 months you should be okay. Now, the next, and I'm going to jump to this point before you add to it, is this the variants that we are seeing and the mutants that we are seeing. Today we have no answer because we in the next few months, people are already looking at, if you have a mutant, you don't know whether it should be included in the vaccine or not. So whether we include the mutant in the vaccine, at what point we actually include these mutants in the vaccine, we have no answers. But yes, the scientific community is quickly working towards including some of these important mutants in the vaccines. So the next year's vaccine is going to be something different from what we have this year. With the mRNA technology, it's a computer switch. Okay, you change the program and you have your new amino acids included in the vaccine. With Covishield, with Covaxin and Covishield, they'll probably have to do a lot more research. But yes, for 10 months we are okay. Next year we'll talk again when we have some more information, Sarita.
Sure. So take home message here. Do the best what you can do in this moment. People, please listen carefully. Rather than speculating कि इसका कितना असर रहेगा, कब तक रहेगा, क्यों लगवाएं, बेकार है, क्यों करना है, risk है. I think you need to be rational and realistic that in today's day, today's moment, the best is to get the vaccine. As more research comes up, as the more mutants are discovered, the vaccine will get improvised. They will be adding more components to it, and the newer vaccine will be taken care. They will be taken care of by our scientists. Please go ahead and get it done. So, ma'am, there are another few interesting questions that very common scenario actually. First vaccine लगवाया, उसके बाद COVID positive हो गई. Now, do I need the second dose? That's a very, very common question. I think 2 people have consecutively asked me in the chat box. Please help me with that. कि एक होने के बाद COVID हो ही गया है, तो antibody होंगे ही, तो क्यों लगाना है?
So this is again interesting. If you have developed COVID after the first vaccine, I would delay the first dose. I would delay the second dose for 3 months, but you have to take the second dose.
Okay.
There's no denying that.
Okay. Understand, ma'am. Also, there is another question, the ideal gap you have covered. What if my antibody level is already high? Is it recommended कि मैं antibody test करा लूँ? और अगर already ज़्यादा है तो I can skip the vaccine because I already had COVID. The question here becomes कि naturally acquired antibodies with COVID infection versus this vaccine-induced antibodies. Is there a difference in quality and immunity?
Definitely. So as I mentioned earlier, the antibodies that you probably have looked at is the IgG antibodies to the nucleocapsid and the IgM antibodies, which is called as the total antibody. These are not the neutralizing antibodies. The neutralizing antibodies which we are looking at after the vaccine are different because all they do is they prevent attachment of the virus to the lung or to the nasopharynx, as we call it. They prevent infection. So they are very specific. They neutralize that receptor binding domain, as it's called. So the attachment is prevented. That's all that the neutralizing antibodies do. They neutralize that attachment. So those are different antibodies. So if you're positive for antibodies, I don't think it means that you cannot take or you should not take the vaccine. Still go ahead and take the vaccine. If you've had COVID, you will take the vaccine after 3 months. If you've taken 1 dose and developed COVID, you will take it after 3 months. So 3 months is actually the key word that we use for the interval between vaccination and COVID development.
Right. Thank you so much, ma'am, for covering this, all these questions, and you have so beautifully and precisely answered all the questions. I'll just flash some more questions which people have been sending me. Allergies, we have already covered, Mr. M.K. Jain. Only please go to a center which has a backup in case you develop a reaction to it. For anticoagulants, I have already told, please contact your physician.
Just quickly to add to that, food allergies and these kind of hypersensitivity, skin allergies, food allergies, they are not contraindication to the vaccine at all. They are unrelated, technically speaking.
Right. Okay. Somebody has asked that somebody got positive after first dose. We just answered that, Vinuta, that after the, yes, you
After
can
3 months?
wait after 3 months and then go ahead with it. You better go ahead with it, because once COVID done, it doesn't mean that you cannot have it again. So please do. We have just discussed it in detail. जानकी देवी, periods का कोई लेना देना नहीं है आपके vaccine time से. Please don't go by your WhatsApp university. Please follow, sincere advice from professionals. There is no connection कि period के time पे आप ले सकते हैं या नहीं ले सकते. Please go ahead and take it whenever your turn comes. So most of our questions are answered, ma'am. Anything from your side which you would like to pass a message? Because I do understand none of the vaccines have 100% immunity, but I understand there is one thing which is quite effective, which is this mask. I think people cannot forget that after getting vaccinated, do not take still the virus granted. The mask is still compulsory. So I would really appreciate if you can add some words of wisdom and,
I agree,
say.
Sarita, I agree 100% with you that no vaccine is 100% efficacious. So please don't let your guard down. In my opinion, the best vaccine is double masking and social distancing. So please don't let your guards down. That is the best vaccine, no doubt. There have been people who have survived this pandemic just using masks appropriately in the right way. I think masking is a different topic. We'll save it for another day. So stay safe, everybody, and good luck to you. If you have any more questions, feel free to contact Sarita
Yeah.
or me. I think I'm open to that. Thank you so much.
Sure. So thank you very much, ma'am, for sparing time for us, for our channel, for our for your valuable advice. It's like it's immense. It's this number of years of experience and that authority and that authenticity what we were looking for, and I'm sure our audience has greatly benefited. So. Thanks a lot for audience to be with us and to listen to us. I'm sure you people have got benefited. Thank you, ma'am, a lot. एक छोटी सी चीज कहना चाहूंगी कि पैंडेमिक्स पहले भी बहुत हुए हैं. ये पैंडेमिक भी एक पैंडेमिक ही है. पहले ना तो हमारे पास फैसिलिटीज थी, ना वैक्सीन थी, ना इतने इंफॉर्मेशन थी, ना इतनी नॉलेज थी. स्टिल पीपल सर्वाइव्ड. Still people survived and earth is there. It's just that we have to create the balance on this earth ताकि ये पैंडेमिक जब भी आए हमारे रिसोर्सेज खत्म नहीं हो जाए. सो यूज द रिसोर्सेज वाइजली. एंड दो लाइंस कहना चाहूंगी अब इस हमारी सब ऑडियंस 100 ओवर पीपल वाचिंग अस. वक्त रहता नहीं कहीं टिककर, इसकी आदत भी आदमी सी ही है. वो वक्त भी निकल गया, ये वक्त भी निकल जाएगा. वक्त ही तो है, या तो बदल जाएगा या तो संभल जाएगा. सो पीपल स्टे सेफ, stay protected. Please wear your mask carefully and just let this fight continue against corona. Go get yourself vaccinated. Thank you very much for watching this. Thank you, ma'am, for your time.
Thank you so much. Beautiful sayings, and stay safe, all of you. Good luck and goodbye.
Thank you.
Thank you.
Thank you.